right, good evening. We'll call the council meeting to order. First item would be adoption of the agenda. Move. Second. Adoption, all those in favor? Motion carried. And just for the information of those attending, we do have a public hearing scheduled for 6:30 regarding bed and breakfast and home occupation amendments to our bylaws. So if we're not completed the agenda by then, we'll take a break for the public hearing. We have this evening delegations. First of all, we have Joanne Schroeder here regarding the Community Health Network Planning Committee. So Joanne, please come to the podium and you have 10 minutes for your presentation.
Thank you. Hi, good afternoon, evening. Thanks for allowing us to come today. I'm here on behalf of the evolving, emerging Comox Valley Community Health Network. I'm actually the Executive Director of the Comox Valley Child Development Association, and our organization is one of the partner organizations with the Community Health Network. So I think we had some slides, so I don't know if you guys had those.
I think we did get them on email, but we should probably get them up on the screen. Sure.
Sharing.
Sure.
So I'll just keep talking and tell you what in terms of what we'll cover. I'm just going to talk a little bit about what is a community health network, give you some background on the other existing community health networks on Vancouver Island, and tell you a little bit about what our planning committee has been up to over the last number of months, and then talk with you about how you as local government folks might want to be involved, and then just tell you about an upcoming public forum that we have.
Okay.
Sounds like there's a connection.
Something's happening.
We're just a bit slow here.
Just take a second. Or a minute.
That's okay. A minute. Okay, I'll keep talking. So a community health network is really about people coming together, and you could probably just go straight to slide number 3.
Okay.
Thank you. People coming together to really promote the health and well-being of our community. In this case, the community is the Comox Valley, and the premise of it is that the whole is more than the sum of the parts, and by working together and trying to have a collective impact, we're going to have much more impact on some of the social determinants of health in our community. So it does provide that forum to identify what some of the key issues are, set collective priorities that really transcend the boundaries of municipalities, organizations, individuals, but really brings together people from a variety of perspectives to talk together about what we can do together to promote a healthy Comox Valley. You can click. Thank you. You can probably click. There's some things.
Is that clicker? It's past you.
Oh,
I think it's advanced.
well, sure, you were doing a great job.
I guess that's don't say that.
I'm going to go right through this one, I think. And so I'm sure that you're familiar with the social determinants of health. And social determinants of health are just that. There are things in our society that determine our health. And as you can see by this slide here, on the right-hand side, are all of those determinants, all of those things that are characteristics of our lives, our economic status, our education, our social support, gender, etc., that contribute to us having different risk factors. So we all know that there's a connection between your income level and your physical fitness. And there's a strong correlation between that. And so those determinants lead to those risk factors that then lead to those diseases. And the idea of working on the social determinants of health is you really start to have a positive impact on those determinants and reduce the incidence of the risk factors and the diseases. So it's not, it's like the old adage that has been around since all of us were little kids, and that is, an ounce of prevention is worth a pound of cure. And really wanting to do more upstream work that creates a healthier place for all of us to live. So far, we have had lots of people, hundreds of people, literally on the mailing list involved with the planning for the Community Health Network in the Comox Valley. Lots of just interested individuals and citizens, local governments, First Nations, and many community agencies and organizations like the Child Development Association and lots of others. One of the reasons that the idea around a community health network got started in the Comox Valley is that we learned, and Betty Tate, who's here along with me, was one of the real initiators of the project, that we're one of the few places on the island that didn't have a community health network. So, and then the question is big, why not? There's funding available from Island Health to support the work of the community health networks. And when we asked Island Health, why don't we have one? And their response was, well, nobody asked. And so this committed group of folks got together and asked Island Health, can we get going and create a community health network? So you can see by that slide there where they are in other places on the island and how long they've been in existence. So it's really not a uncommon infrastructure. In most places, the funds from Island Health have been flowed to the regional district, and the regional district has contracted out the staff support. I don't think in any case they've actually hired a staff as an employee, but there is funds up to $80,000 a year available from Island Health to support this work. This just gives you a little bit of an overview of the things that we have been up to as a planning committee. So lots of just reaching out to people, trying to explain to people what a community health network is, what are the social determinants of health, why would we even care about that, engaging with the representatives from Island Health who have some responsibility in this area. We've actually not only planned but held a mapping meeting in September, so we brought together a lot of the people who are already working on these issues. So the Coalition to End Homelessness. I'm very involved in a group in the community called the Comox Valley Early Years Collaborative. There's lots of groups that are working on different aspects of the social determinants of health. And in creating the health network, we don't want to recreate the wheel or to step on the toes of all of those folks, but to actually build on their knowledge and experience and bring it together in a different kind of way that gives us more impact. So we had a great time, came together, everybody did visuals of the work that they've done, and it was really quite an inspiring time to say, yeah, we've done a lot of work, but by coming together we can actually do a bit more. We've been working on collecting some of the data that's available in the community. You probably know that the Community Foundation produced a report last year called Vital Signs, which really provided some helpful data in many of the issues that we would be looking at together. Secured some funding to do the initial stages of the work, so we have secured funding both from a private foundation and also some from Island Health, as well as the Comox Valley Healthcare Foundation and the Association of Registered Nurses of BC, to give us just a little bit of seed money so that we can continue this community development consultation process. So that's designed to take us through to about the end of March. So we have secured that funding. And then most recently, we've hired a facilitator and we've been working together to plan this community-wide forum that's going to take place on the 16th of November. These are some of the things that we think are a benefit of local government being involved in the project. So not what you can do for us, but what we can do for you in terms of really engaging around some of those issues that you're already very actively working on around air quality, transportation, housing, recreation, all of those things that are things that are part of looking at the social determinants of health. And we can really provide local government with some of the information that we're getting on a very grassroots basis from people around the community. What I'm asking of you is not very much at all, really just to be around the table. That it wouldn't be something that we would be looking to local government to fund. There's no particular ask in respect to that, but just to be part of the network. Because if we really are going to create a healthier community, we can't do it in isolation from local government. You guys have a very important role to play in terms of really allowing us to further our thinking about this work. And so we really need your leadership to say, yeah, this makes sense, and this is something that we want to be involved in. You're most welcome to come and participate in the forum planning with us. Or, if you don't want to participate in the forum planning, please come and join us on the 16th of November at the Native Sons Hall, where we'll be having the full-day forum. Hope to have about 200 people there to really push this idea to the next level. Coming out of the forum, we're hoping to have develop some infrastructure, and that we would definitely want to have the involvement of the town at the table of partners.
All right. Thank you. Maybe questions from members of council? Go ahead, Councilor McKinnon.
Yes, a couple of quick questions. First of all, I'm an advocate of coalitions, and I think they can be benefit to a community. I've got a couple of questions in regards to that. What I hear you saying is you're asking local government for intentional support, not financial support.
Right.
Okay, just to confirm that. And secondly, can you give an example of, with the Island Health Grant, what some of the other communities on the island might have been able to do to better their community health?
Absolutely. So I think one that comes up in a number of places is transportation. So that's an area, that we look at from the early childhood perspective. It's very difficult to get around when you've got lots of diaper bags and strollers to push. And it's also an issue for seniors. It's also for people who, are of a lower income. So we've worked together to really try to enhance the transportation infrastructure in communities. So that's been one that people have definitely worked on. In the Cowichan Valley, I know they've done lots of work for seniors across the community, so really bringing together a number of different groups with seniors as identified as a priority in that community. So that's a couple of examples.
Councilor President.
Yeah, and great the work you're doing. Do you see it as one table, or is it different groups with one with a focus on seniors, one with a focus on environmental factors?
How those pieces fit together, I think we'll plan together with the folks that are already working in all of those areas. In some of the other places, Alberta Clackpot comes to mind. They do have this table of partners. So the existing groups, so in our community we do have all these existing groups, they continue to do their work focusing on the issues that they have been, but they'd send a representative to a table of partners. I think we're super conscious, because most people who are at our age have been to way too many meetings in their lives. So I think we're super conscious that we don't want to just create more meetings for people, but how can we really realize that power of the collective. So that's one of the models we're thinking about, is just having that table of partners. And that's where we could see a really effective role for local government.
Thank you.
All right. Seeing no further questions, thank you for your
Okay,
presentation.
here's all the info to sign up. We'll make sure you get everything you need for the forum. Thank you.
Cheers. All right, our second delegation this evening is Leslie Wells from MAD Comontana. Welcome, Leslie.
Thank you.
I have a really beautiful PowerPoint link to it. I do have a couple of handouts for you. So maybe I'll just pass these around when we get started talking. So I'm Leslie Wells. I'm here as a representative of the new MAD Comox Valley chapter. Just a little bit about MAD. Most of you probably are familiar with it. But the goal of MAD is, of course, to support victims of impaired driving. That's impaired, including alcohol or drugs. and also to stop impaired driving, to really limit this crime. So one of the ways that we do that is by increasing awareness in communities. Many communities have signs, which is what I'm looking for from you guys tonight, is permission to put a sign that says report impaired driving. We've got examples of several of the signs. 3 of those signs are from Nanaimo, and the blue one is actually from Comox Marina. It's a impaired boating sign. So we have one of those at each of the marinas in Comox, but we don't have any on our roads. These signs are effective, and we know from experience that education does make a difference. So we've gone from not even having a blood alcohol limit at all with driving and not really even concerned about impaired driving to lowered limits of alcohol allowances for driving, and continued work in that area. So Comox doesn't have any of these road signs. I did bring a small sample of actually what the road signs look like. So this is a small mock-up. The sign is made out of the same material that all of the official signs are made up of. Very few words so that it doesn't cause a crash while people are trying to read the sign. The signs would be bigger than this, but it can be whatever size is designated by. Yeah, so our thought was it would be wonderful if we could have 2 signs at the entrances to Comox. We were thinking at the top of Comox Hill, not right at the crest of the hill, but somewhere where it's safe to have that sign, and the other sign on Ryan Road at the entrance to Comox. However, we're totally open to any other locations that people would see fit if the signs are approved. MAD will supply the signs, but we would need to have them installed by the city.
Right.
So that's what we're asking for, permission to install a couple of signs, and also providing the labor to install them from the town of Comox. We will be checking with the city of Courtenay and also the village of Cumberland about signage there, and also on the highways, both entrances to the valley. So that's pretty much it.
Any questions?
Straightforward.
Go ahead.
Well, as long as you don't want to put any on Robert, that's. Anyway, no, I think this is a good idea. This seems to me to be one of those things that you could probably just work with staff through. I don't think you could go anything more.
I guess we'll ask staff if there's any issues that you foresee.
No. No, they can work with us and we'll determine the locations and install the signs.
Put them next to the Boil and Water Advisory Center.
Okay, thanks very much for your time. Oh, sorry, yes, just go ahead.
It's obviously, MAD is a name, a word that means a great deal to all of us.
Mm-hmm.
And having said that, when did it change from MAD to impaired?
It isn't. It's MAD, Mothers Against Drinking.
Yes, I know, but I guess that caught my eye because we're very much into legalizing cannabis, etc. And I thought, oh, that's smart.
Yeah.
So, but I didn't notice when.
Because we haven't changed it in the acronym for the name. It's Mothers Against
No, you haven't.
Drinking
Yes,
and
I
Driving.
noticed.
Yeah, drunk driving. It's not
Yeah.
against the drunk drivers, but against the act of drinking and driving. But we do support people who have been injured from impaired driving. So that's the language that we use in that.
I realized. No, I thought it was a very good
Yeah,
move.
we can't really change the acronym because then it would be MADE, and
I know.
that's a totally different thing. So stick with MAD. Yeah.
Any other questions from members of council on this side, Councilor McCann?
Just a quick question. A great program, and it's got lots of support. The putting up the signs to town, I think our CEO said that that's something they could do. What about long-term maintenance? Is that handled by MAD itself?
You know, I haven't even asked that question. I don't know that there's a lot of maintenance on this. I guess if there was graffiti or something, a person would wash up.
I was going to ask, how's that handled in other communities? Or?
Yeah, I don't know, but I can ask that question for sure. Yeah. The signs have a coating on them, an anti-graffiti coating on them. I don't know how well that works, but yeah.
Councillor
Yeah,
Price?
great, I will ask that question.
And great work. And have you thought of including distracted driving too? I hear more and more that
Yeah.
actually there's a greater risk from cell phone use than
really
actually
big
drinking
problem.
and driving.
Yeah.
And a lot amongst young people. So getting that message out too, that also
That is important.
kills.
Yeah. So-
ICBC has a campaign on that, so that's probably where
They
you
do, they're really focused on, you guys maybe have noticed the RCMP officer that weaves his way through traffic on the bike, I don't worry so much about that. But that's really great. Yeah, so I've actually just accepted a position on the national board at MAD, and so those are some of the questions that I have too. Just really any vehicle crashes where people are injured, it's just not good. With the impaired stuff and with the distracted driving, those are 100% preventable. Just don't do it. Like, drink all you want, smoke all the drugs you want, but don't get behind the wheel and don't use your cell phone. Yeah.
These ladies would argue with that.
All right, so thank you for your presentation. I encourage you to work with staff
Thanks
on
very much.
the installation
Would
side
you
of
mind if
it.
I collected a few of those back just so I
Yeah.
can...
Yeah, might as well.
Great, I don't need them all back.
That's okay, we
But we're under-
keep them for your future.
Great, thanks so much.
Yeah, you too.
Oh, great, thank you very
All right, so we'll move on to minutes of meetings for approval, the September 20th council meeting.
Second.
Approval then, all those in favor? Motion's carried. And then we have under unfinished business, the manager's report for receipt.
Move receipt.
Receipt then, all in favor? Motion's carried. There'll be a couple of reports coming, I assume, in the next few weeks on items 5 and 6 and 7, correct? So those will come forward. Anything else? People have questions? Go ahead, Councillor Swift.
I know is there any update, I know it's not technically organic waste, but regarding the recycling and...
Yes, I think our CEO can speak to that.
That was a question I had as well.
We're just in the process of working on the initial broadcast of the communications material. Shelley, is it on the website or is it going to be on the website in the next few days?
In the next few days, Friday, early next week.
And that's the beginning of the awareness campaign. We are still in the process of signing the agreement with Recycle BC, and our anticipated start date is the first week in November for collection. So I believe it's November 4th is the first collection day for co-ops.
So, sorry, on the same thing, Richard, is that how will citizens be notified of the change?
In multiple ways.
Let Shelley speak to that.
So, yeah, we have hired a communications firm to help us out in that regard. Number of website, first and foremost, up on the website, social media, Facebook, Twitter. We'll be having some brochures made up, which will be distributed either by bulk mail out to all residents or delivered in their boxes. Putting together some promotional videos as well to go up on the website. So there's a number of things that we're doing to get the word out.
Thank you. All right, anything else on the manager report? Yeah.
Just wanted, is there any update regarding the fixed wing?
Yeah, groundbreaking December 1st.
Really?
That's what I was told by
Is it?
the wing commander, but
Okay.
it's also in building weeks I think this week, so we'll see. I haven't seen an actual formal invitation for that, but that's what we've been told.
Great, thank you.
December 1st.
You'll hear more about that as we get closer. Okay, so we'll move on to special reports. We have report receipt, minutes of the Regional District Board, Solid Waste Management, and Hospital District.
Move receipt.
Second.
All in favor? Motion's carried. Anything arising out of those? I'm sure we'll hear about some of those things in our council reports. And then for adoption under the bylaws, the permissive tax exemption bylaw.
Move.
Second?
On adoption, any discussion? Seeing none, all those in favor? Any opposed? Motion's carried. So that'll move us to correspondence. So the first item is a letter from the Solicitor General regarding cannabis regulation in BC, so that is just more for receipt and any further discussion.
Move receipt.
Second.
On receipt then, all those in favor? Motion's carried. For those of us who are at UBCM, there was a session on this there, and you'll see that they're looking for input from the public and from local governments by no later than 4 p.m. on November 1st regarding what's being proposed. And of course, it's a bit of a work in progress, and there was, again, fulsome discussion of it at UBCM, and there were several resolutions in that regard. So this is information, an information piece. It's certainly open for any members of council to, and the public, of course, to submit their own comments. Whether we want to have any kind of council position on it, I guess would be up to council and perhaps staff. At this point, we're not sure what the retail model will be, whether it involves liquor stores, pharmacies, or what have you. So there will be some role for local government to play in terms of, I think, simple things like business licenses and the like. So I don't know if CAO has any other introductory comments?
Not at this time.
Okay. Go ahead.
Well, I'm just wondering, I was talking to Larry last night, and he says they've got a dispensary that's opened up in Beaumont, or Courtney, in 4th Street.
Until today, I mean.
Well, but, you know,
It's
it's
shut down.
Yeah, but, you know, it's getting into that whole realm. I'm just wondering where the local government has any say in how we would determine bylaws or what we would do in all of this. I know it's a bit early, but if it's starting already, perhaps it's something we should be
First
putting
of all,
our mind
that's
to.
a medical marijuana facility, which of course is currently illegal. It doesn't have a business license. The local RCMP has made it clear that they will not allow that to carry on business, and certainly the city has a business licensing role in that regard. There was one on the Dyke Road at First Nations land that was also shut down. What this is talking about is, of course, the, for lack of a better word, non-medicinal use of marijuana, in other words, recreational. And the framework for that is still being developed in terms of how and when we'll be able to legislate. Of course, we have powers under zoning, we have powers under business licensing. As far as things like setting the minimum age and consumption in public or not in public, those kinds of issues, those will be governed by the province. In terms of taxation, the federal government's recently proposed some excise tax legislation, but that's still on discussion. I guess from our point of view, we haven't had a dispensary open up here, but if we did, it wouldn't be entitled to a business license, and it would be likely to be shut down by the RCMP fairly quickly. So, at this point, that's where it's at.
Well, just thinking though, in terms of the recreational use, or either one of these, that, I mean, we need to start putting our mind to how we, at the local level, would deal with that. In the ways you talked about is fine, but, I mean, it's something, I think you want to be kind of ready when the time comes, rather than behind that curve.
Yeah, well, that's why I put this on the agenda. If the members of council would like to refer this to staff for report, that's certainly one option. We have till November 1st to put some input into the provincial engagement process, but it's more of a Q&A as to what we might want to do. A large portion of this will be legislated by the province based on input, and our role, as I say, won't necessarily be anything new in that regard, in the sense, be regulated in terms of public consumption by tobacco, similar to tobacco perhaps, in terms of public use and where you can smoke it or use it. As far as business licensing and zoning, it will depend on what model they opt for. If, for example, it's going to be proposed in liquor stores, either as part of a store or beside a liquor store, like they're proposing in Ontario, there may be some zoning issues related to that. So it may be too early to say what exactly our role will be, but if you want to have input, I guess, into the provincial process or suggestions, for example, some of us might think that it should be retailed through liquor stores, or some of us might feel it should be through pharmacies. I don't know. Some of those would be personal opinions. Some of those might be a council opinion, having a report from staff. Councilor McKinnon.
We just had a speaker talk about the power of collectives, and I wonder if this might be a time for our CAO to consider with other CAOs from the Village of Cumberland and the City of Courtney and perhaps the staff from the CBRD to strike a committee to, after this discussion paper review, we're going to have common questions, and least of which to generate some questions and thoughts that might be useful in this regard. This is all new. We do have one a close geographical area that's been through it recently. That's the state of Washington, and they had a speaker come up and speak at our UBICC a couple of years ago when it was here in Courtenay. But there may be some value in reps from all local municipal governments getting together, staff, and just generating some questions and some ideas to pass forward to the province. If they hear nothing from us, they're going to go ahead and do it. Maybe there'll be no concerns that come out of it after the discussion paper review, but it may be an opportunity to do that and see if there's interest from the other communities.
Well, certainly our CEO can talk to his colleagues, but I think this is more of a public engagement process, not a staff engagement process. This is, what are you hearing from the public? What concerns do you want to bring forward? Comox may have different concerns than Courtenay, for example. It's optional for us to feed into this. You can do it individually if you wish. From a staff point of view, they may hear from their councils or boards as to what they want to do, but until such time as the government does bring down actual proposed regulations, it's hard to say what our role would be. I wouldn't want to see our staff necessarily spending a whole lot of time on that until such time as we know what the regime is going to be. Then maybe that would be something that would be relevant. But at this juncture, till November 1st, this is a public engagement process. You are elected by the public. You talk to the public. If there's comments you want to bring forward, either individually or through council, that's the process now. Councillor Price.
I think it would be good to have a staff report, and certainly there is a small window of opportunity, and I'm certainly hearing the province wants to hear from local government, and how it unfolds, how the province unfolds the legislation will have a big impact on us. And this is this window that we can actually bring forward. And it may be, as you suggested, a series of questions, concerns,
Sure.
How would this be dealt with? But I think we'd be missing something if we didn't actually report from on the ground. This is happening really fast, and that's the unfortunate side of it. And I certainly got the impression that the province isn't ready. So they are looking for input.
Yeah.
So
we can certainly ask for a staff report if that's council's wish at this time.
yes.
And it can come back to perhaps a committee of the whole this month. You've got other reports to deal with, but I mean, quite frankly, I don't think it's going to be the kind of report that will necessarily delve into all the pros and cons of this. It's going to be, here are the powers that we have. How can we legislate to enforce them, depending on what happens? Business licensing, zoning, those kinds of issues, obviously relevant to any kind of business.
And putting this back on the agenda too is just more of a forum for us to discuss. They've raised some very good questions in this paper too. Sure. That we can answer. So yes, I don't see it as a big piece of work.
Council is, staff isn't going to necessarily provide a report on, things like minimum age and public consumption and youth protection and things like that. And of course, the drug impaired driving issue is really going to be in the purview of the RCMP. So I think it would be more, what kind of powers do we have? How could it affect our staff in terms of inquiries, and then go from there. So based on that, that might be the purview of the report. Sorry, Councilor.
No, go ahead if you're...
I just say the intention wasn't to create extra work for staff, but I think being ahead of the curve might be a good thing, even if it's general questions that are raised from a community. That's my 2 cents worth. Sorry, Ken.
Well, no, the only thing that I would say is regarding, if we're going back to the province, would be around taxation. And we're going to get the cost of the policing and the healthcare issues, because it's all going to fall down to our level. And so we should get a larger portion of the tax if we're going to have to divvy up that. So if we have an ask, I think that's an ask.
Well, as of earlier today, or maybe it was yesterday, the federal government at least has proposed a 10% excise tax 5% to the feds and 5% to the province, which of course is very much up for discussion and will probably be dealt with the First Minister's Conference on Finance. But I mean, we can certainly point out that there may be a regulatory burden that we will incur that should be shared, but it's no different than anything else that we get foisted upon us. So,
Yes.
and one of the reasons, for example, why we've pushed off any moves towards no smoking in parks and playgrounds is to say, well, we have no resources to deal with that. So the same would hold true here. So, I mean, if it comes to a zoning issue or a business license issue, we would deal with that like any other business. But there may be other regulatory burdens that we don't know yet. And certainly we could say, well, give us some money and we'll try to take care of it. But it's also undetermined at this point what that might be. But I think staff can, perhaps, if that's council's wish, within those purviews, provide a report, and it would have to come to us by no later than the second cow this month for us to have feed into it. Is that feasible?
We'll do our best, yes.
Okay, so a motion to that effect.
Second.
On staff report, all those in favor? Motion's carried. All right, so that'll come on us fast and somewhat furious. There you go. Good stuff. Okay, well, thanks for that. That's why I put it on the agenda for that kind of discussion, and that's helpful. Second item, correspondence, I believe is from Giovanna Coughlin regarding traffic concerns on Knoll Avenue near the Philip and Jimmy Day Academy. So motion received.
Second.
Are received then, all those in favor? Motion's carried. Now, with that in mind, I guess, given that we have traffic calming policy coming forward to us, would it be fair, CEO, to include perhaps some reference to that in that report?
Yes.
Because I know we dealt with that at Beaufort and Ellis. Unless there's something else specific people would want to see.
I'm just wondering, have we actually talked to the school to find out if, I mean, this could be a one-off, or is there actually a problem that they're having, or?
I don't know.
The school the school seems to be doing a lot of the stuff that it sounds like we would be doing.
Any feedback from the school staff?
Not that I'm aware of other than this.
Well, perhaps that might be something that staff could look into in the meantime, make an inquiry of their principal, or a picture about whether there's any issues here. Because you're right, it could just be one parent saying there's a concern. So, with that in mind, I think that's probably within the order of receiving it and referring it to staff.
If I could just make a comment, because I did teach there for many years. And like most schools, the parents are very anxious to pick up their kids. The one thing I did notice, though, is the yellow line is almost non-existent there.
Faded.
Yeah. So that might be a really quick, simple thing.
Apparently we have extra no parking signs we could put.
Well, even just getting out there with our paintbrush for the
Must have
community
several
hall.
hundred.
We moved away from painting because of operational costs and moved to the sign approach.
Well, that's something that maybe in staff's discussions with the school, that there might be a simple solution of putting up a couple signs. So I did emphasize a couple, but
Yeah.
25.
Small school don't have.
So I meant maybe that can come back to us with the report. I mean, there's no time sensitivity on this aspect of it, but if it's coming as part of the traffic calming, maybe there could be a footnote added to it. I'll just comment on the suggestion that we utilize the other things that are at 5th and Fitzgerald, having seen those in operation outside my office for the last few months. That is not a solution. So. And we don't want to voice that on any of our neighborhoods because all it does is create confusion. And I think it's important to reflect that people need to expect the expected and not the unexpected. And if you start putting up things that nobody understands, it's a recipe for disaster. And it might give people a false sense of security. So, yeah.
Your Worship, just a quick comment is that I do appreciate that the person took quite a bit of time to create these photos and whatnot. In my mind, what makes Knoll different than the school in that area, different than other schools, is the hill there. And the speeds are, it's tough. You have to be mindful to brake and slow down coming down that hill. I think I agree that the staff to contact the principal and then have a look at it and report back to us. Student safety in that area is, I think, very important, and I appreciate that the person took the time to do it.
Yeah, you bet. I mean, one of the challenges, of course, will be that the very people taking their kids to school will be often the culprits, as we found in many cases.
Very true.
So anyway, fair enough. It'll be incorporated in the traffic calming report as a footnote, and staff can hopefully contact the school staff and see if there's any other possible solutions.
I'll confess, I've had trouble braking and my bike stopping for some of the kids crossing there. It is coming down.
That's because you use your feet.
One snowmobile's on the side.
I walked into that one.
Is it possible just to revisit the paint as well, not in every circumstance, but just looking at it rather than rule it out altogether? Signs, you know, you can get too many signs and people just don't see them, and then you get the visual clutter, and I think, you know, we did a good job on Robert demonstrating what you can do if you really oversign. So, I mean, there may be occasions where paint just does the job a lot better because it's right in front of your eyes.
Well, let's be staff speak to it. They've obviously gone down this road and have made some operational decisions in that regard. There's also the enforcement issues too, that without proper signage, you, regardless of what color paint or how much paint you put on there, you will have problems sometimes enforcing tickets. So signs, unfortunately, are part of that picture, not necessarily every 10 feet, but if you don't have a sign there and you don't have the ability to show that on a ticket, then you might not enforce it.
Painting is an annual occurrence. So the more paint we put in the community, the more bodies we require to attend to it on an annual basis. And we've moved away from that simply because we just do not have the bodies to focus on that at the moment. The sign is more permanent. It may require washing every 5 to 10 years, but generally speaking, there is no maintenance. The message is supposedly quite clear on the signs as to what's intended for the drivers or the parkers or whomever. We find them more effective than, yes, the yellow curve is more visually noticeable if that is what you're looking for. But at the same time, if you're responsible enough to look after a vehicle, you should be responsible enough to follow the enforcement signs as well.
Well, and they got those new signs, I don't know if you've seen them, with the yellow right down the whole pole now, so those are really visual. But it seems to me that our paint, we've gone away from the oil-based paint and gone more to a water-based, and it just doesn't last. Like in 6 months, and it's done.
It's also all part of being more environmentally friendly.
Yeah, so
It's all part of it.
So it's, yeah, I mean, because I noticed a place where we did paint and it didn't last 6 months and it was gone again. So,
All right, so we'll leave that to staff to bring back to us with some further input from the school as well. And we go on the, we just vote on receipt, but that's probably sufficient.
Yeah.
All right, last piece of correspondence is just for receipts and approval is the annual pumpkin carving underwater contest.
receipt and approval.
First annual.
Second.
Wow.
Any further discussion? Seeing none, all those in favor?
We volunteered you to
Yes,
do it.
yes,
Actually, Councillor Arnott did it last year, so since he's not here tonight, I'm sure he'd love to do it.
Okay. Excellent. I like it.
The opposite gender this year.
He's looking for an issue, so there we go.
Usually we say he's all wet, but now he's They go on for hair. I got one laugh. A couple booze, one laugh. All right, so no other late items or delegations, reports from members of council. We'll start with Councillor Price.
Okay. So I attended UBCM. As part of the Town of Comox delegation, I met with Minister Scott Fraser, Indigenous Relations and Reconciliation, about the MOU with the Comox First Nations. Also the Health Minister, Adrian Dix, about the continued role of St. Joe's. BC Hydro reps about funding for underground wiring. Also as part of UBCM delegation, met with Minister Ralston, Jobs, Trade and Technology, to give input on the focus of UBCM Economic Development Committee and hear the Minister's vision. Carried out convention assignments as a member of the UBCM Executive, including attending a UBCM Executive meeting where we had a chance to talk with Minister Robinson, the new Minister of Municipal Affairs and Housing. Great convention, and as you mentioned, big focus on the upcoming marijuana legislation and the role of the province and local government. BC is still in early stages of determining direction, and like some other provinces which are further ahead. Another outstanding workshop was advancing local government First Nations relations. A reconciliation means a true sharing of prosperity. When a First Nations prospers, a whole region prospers. This was a quote from the Celestine Maldane, Chief Commissioner on BC Treaty Commission. BC, we have unique land and resource issues. Historically, treaties haven't been signed in BC. That's why over 50% of the treaties on self-government tables are in BC. And we have very small reserves in BC, and like the federal average is 2,000 hectares, and in BC it's 224, partly because land was also taken back to be reassigned to settlers. So UN Declaration of Rights of Indigenous People, very important, and the province is about to adopt it, and I think we need to look at doing this in Comox. Some great examples of local government and First Nations working together, specifically Alert Bay, Beecher Bay, Chosen, Ladysmith, and they all included examples of First Nations and municipal council meetings, municipal councils meeting together as a successful way to work collaboratively together, focused on solutions and looking forward, not backwards. And I did have a chance to have a few words with the mayor. That's maybe something we might like to look at if our local band is also interested. This mid-sized community forum focused on innovations from a range of communities. Dawson Creek developed a reclaimed water plant, water for watering parks, and also selling it. They also had kindness meters, which I thought was a great and simple idea, that discarded parking meters, people put their change in and the money goes to charity. Sunline solar projects, and a lot of good ideas that's happening around the province. Cabinet town hall sessions, and of course resolutions, and we got through all the resolutions. Great keynote address by Terry Molesky, and prior to UBCM I attended a CAMS meeting. Just want to point out that 2 new heritage signs have gone up, one about the 102nd Battalion and one down by the compass that's describing what happened at Hugh Spit with the troops there, and thanks to Al Fraser for his help. And this adds to the 3 we've already put up, and all paid for through CAMS and part of our outreach, as is our chair's presentation on Dusty, just there at the Destaire House, November the 19th, and that we are looking to create another school box working with the school district. And with the funds we've got from Canada 150, we're looking to digitalise the mapping that we've done, which will be on the website. And I also attended the elected officials forum last night, which was on emergency work that we have been doing on the mainland with the forest fires and on emergency preparedness in general. Thank you.
All right.
we've used all of Councillor McKinley's time, so we'll move on to Councillor Grant. Now, you can report, but everything you wrote on Facebook is already out there, so you don't have to report all that. Go ahead.
Since we last met, I attended the Philburg Apple Press event on September 23rd. Representing the town, spoke at the Kidney Run at Sims Park on Sunday the 24th. I too attended the UBCM, and I'm willing to share some notes on topics that Councillor Price didn't mention. One was dissecting affordability and root causes and implication. They talked about some taxing tools to cool the real estate market. As well, there was, it's not mentioned, one that was of particular interest was short and long-term rentals and affordable housing, room for both. And there were communities, Tofino, Penticton, Richmond, Whistler, and how they dealt with Airbnbs and rentals and that type of issues. So I do have some notes if anybody's interested in those topics and others. I'd be happy to share them. And last but not least, I attended a Comox Valley social planning meeting yesterday, and in Vancouver attended a 47-year reunion of Langara College. Nobody's aged a bit. Mind you, I didn't recognize anybody. That's the end of my report.
Councillor Margaret.
Thank you. Well, I attended the Base Review Information meeting that was giving the other side, i.e. the concerns that the community has with Base Review. Also attended the Emergency Services Forum, which happened yesterday. It was excellent. I was very impressed with the cross-section of information that was given to us. It was good. And there were the positives that come from something like that. First of all, of course, every presenter commented on how good they felt about the camaraderie and knowing that their best efforts were really appreciated on all parts, and also how much they learned in the process. It was great. And I was also impressed to see the Salvation Army. I wasn't expecting them to be involved, and they were, and it was good.
All right, Councillor Grant.
Well, I didn't go to UBCM, so I had nothing to do last week, and I attended the Emergency Services Forum last night, which has been reported on, so there. They can have some time.
Councillor Swift.
Yeah, I attended the Apple Press event, and it was great. I sold all the juice out. The apple crop wasn't that great this year. And the emergency presentation at the RD, and it did remind me, and I did talk to our CAO just before our meeting, that it might serve us all well if we did have an annual review just in Comox as to what our procedures are and so on.
Emergencies, sure.
Yeah.
Thank you. All right, I'll just report briefly a meeting with Chris Kelsey, Chair of St. Joe's, and Jamie Murphy before UBCM, just to tee up some discussions with the Minister of Health, which Councillor Price had mentioned. I thought it was a very productive meeting at the UBCM with the Minister of Health, and he seemed very much favorable towards the future role of St. Joe's as a not-for-profit senior care, healthcare type of center. So we'll see what happens there. He indicated that he would be up in the community at some point in the near future, and we'll be able to hear more. Also had what we call a leadership lunch. It's a lunch of mayors, chair of the regional district, and the CEO of the base. And we did invite the Comox First Nations chief, but she did not respond, so we'll get her up for the next one. There was some good discussion around the table there, and just a couple things from the base, as I mentioned earlier, the groundbreaking for the fixed wing search and rescue in early December, hopefully. And also they have some ongoing issues they're trying to sort out with their intersection at the base with highways. So we'll see what happens there. There's some concerns around safety there at the two-way intersection and the flow of traffic out of the base. So on that basis, I have updated staff on some of those things as well. We had a board meeting for the Economic Development Society. It's a quarterly board as we head towards the budget. And that was a good discussion yesterday. That's why I wasn't at the elected officials forum. And they've got some good information that will come back through the regional district on the impact on local businesses of the Boyle Wire and also wildfire events of the past year. So you'll see that through the regional district. And that's it. So we'll move on with the agenda. in terms of where we're at, I think we're pretty close to adjournment, if not there already. Unless there's any immediate questions at this point. So we'll have a motion to adjourn and then we'll continue our public hearing. Motion to adjourn. Those in favor? Meeting adjourned and we'll come back in 5 minutes for the public hearing.